Hi, I'm Michelle Carroll with Progyny, a leading fertility benefits management company. As you may know, September is Polycystic Ovarian Syndrome, or PCOS, Awareness Month. And we've been releasing videos all month about this common endocrinological problem. And today, we're going to do it with the help of an expert, Dr. Ilana Ressler, a reproductive endocrinologist with the RMA of Connecticut. Today, we're going to talk a little bit about the nature of this syndrome, what causes it, is there a cure, does it result in high-risk pregnancies for those trying to conceive? But first, we want to set a quick baseline and run down what PCOS is.
PCOS stands for Polycystic Ovary Syndrome. It is the most common endocrine disorder that affects women of reproductive age. It's thought to affect up to about 15% of women. It's diagnosed by, you need to meet two of three things. So the first is having irregular cycles. The second is having elevated androgens, hormones such as testosterone or DHEAS, or symptoms of that such as acne, hirsutism. Some people have hair thinning, so if they have either the biochemical or the symptoms, that meets the second criteria. And the third is polycystic appearing ovaries on ultrasound. And these cysts on the ultrasound are really follicles, the potential eggs. So it's really a misnomer and should probably be called polyfollicular ovary because it's not abnormal cysts, which I think is really important to drive home to patients because then they think that their ovaries are full of these abnormal cysts.
We've covered in some recent videos that PCOS can cause infertility. It does this primarily by disrupting ovulation. If a woman isn't ovulating regularly, it can become very difficult to achieve a pregnancy. There's a bit of a myth out there that women with PCOS can utilize an ovulation predictor kit to get around that hurdle, but that is likely to lead to frustration.
Specifically with PCOS, or who have irregular cycles for the same reason that, just testing endlessly can be very discouraging and tedious and a waste of time and money. But for women with PCOS, in addition to that, they actually can get false positives, right? Because women with PCOS tend to have higher basal levels of LH, and the ovulation predictor kits are designed to detect LH levels during an LH surge, which occurs prior to ovulation. So they could be getting those little smiley faces days and days in a row, but it doesn't mean they're ovulating, it just is their basal level of LH being elevated.
PCOS is among the more common reasons patients find themselves working with a fertility doctor like Dr. Ressler. And while it's probably safe to say that nobody wants to have PCOS, in the world of an infertility diagnosis, it's one that doctors tend to be a little more optimistic about when determining a prognosis.
On one hand, it's good because women with PCOS do have good ovarian reserve, so that is a problem that other women battle, right, is having low ovarian reserve or diminished ovarian reserve. So women with PCOS tend to have very high levels of ovarian reserve, but the problem is that the eggs are just not coming out in a routine manner. So they're stuck in there, and at a certain point they may spontaneously progress and release that egg, but unless they're being monitored daily with ultrasounds and blood work, then they wouldn't know when that window was.
PCOS symptoms can be unpleasant, but all of the PCOS symptoms aren't present in all PCOS patients. So it's possible for a woman to have PCOS, but not be too bothered about it until it's time to try to get pregnant. That being said, Dr. Ressler stresses the importance of early intervention when it comes to PCOS.
It is really optimal for someone to address PCOS from a young age. So not wait until they are ready to have a baby, but as soon as it's suspected that they might have PCOS, to see an expert or someone who is able to help them optimize it, because it can impact women in many different ways. We think about fertility at the forefront because that's what brings most patients to us. But having regular menstrual cycles is important for the health of the uterus. So it's important for patients to be reminded that they shouldn't go more than 3 months without having a period because of the increased risk of endometrial hyperplasia or cancer. It is important to keep in mind the association with the insulin resistance. This, of course, can lead to an increased risk of diabetes, and patients suffer often from more of the cosmetic symptoms of PCOS, having acne as adults, hirsutism, which is resistant often to common treatments like laser hair therapy unless their hormones are optimized first, then they're more receptive to those treatments. Also, anxiety and depression are both associated with PCOS, and I think this often gets overlooked. So it's important to look, at the big picture and not just focus in on the fertility. And if we can, again, optimize all of these things going into the reproductive years, then a woman might be in a much better place and might not even need assistance when she's ready to conceive.
A big question that tends to be on people's minds when they're diagnosed with PCOS is it curable?
No, the cause is not known, so there's no cure. So as I explain it to patients, it's something that you're born with, like being born with brown eyes. You're born with PCOS and you'll have it throughout your life. So the symptoms may change for you over time, and the symptoms also vary between individuals. So we take a snapshot of what it is affecting you at this time, and those are the symptoms that we're going to address.
Finally, many with PCOS who want to achieve a pregnancy find themselves wondering how PCOS will affect the pregnancy itself. Does PCOS indicate a high-risk pregnancy?
It is not considered a high-risk pregnancy just by virtue of having PCOS. That said, a woman with PCOS is at increased risk of gestational diabetes, so having screening for gestational diabetes earlier in pregnancy would be recommended.
If you think you may have PCOS, or if you have a PCOS diagnosis, it's important to understand that you aren't going through this alone. This is a very common syndrome, and by working with your doctor, you can manage the symptoms and achieve your goals. Thank you for watching this video. Please click the like button and subscribe, as that will help others find it. Also, if you want a ton more information about fertility treatments or anything else fertility related, we have a wealth of knowledge for you at progyny.com/education. And if podcasts are your thing, check out This is Infertility, wherever you get your podcasts. Thank you.